Good afternoon, ladies and gentlemen. I'm Anjali Singh Kulkarni, trained in social work and public health in India. For the past almost 20 years, I have worked in development sector and academic field of public health. Today, I'm going to tell you a story of me and my views on health equity. As a child, I never knew what scarcity of health services meant. And why would I ever know? Being an army officer's child in India meant I had easy access to health services, and that too at no cost or very little cost. Whenever I felt sick, that ranged from sneezing, coughing, fever to any kind of ailment, in an army jeep, my parents would take me to a military hospital where there was never a long queue. The doctor would prescribe some medicines, maybe some tests, and then I would be taken back home. The medicines, the test, everything was paid for by the government. It was after my father's retirement from armed forces, I realized how cruel the civil world was. I began noticing whenever a family member falls sick, one needs to have some convenient transportation in the first place. Distance of hospital health services mattered. Upon reaching hospital, getting in queue to pay for doctor's consultation, getting in queue to consult a doctor, and finally getting the test done and even buying prescribed medicines was no easy task. It was a hell lot of difficult thing to achieve. Now, there is no specific event, but the differences in access to health services, which I saw as a child and as an adult, it enhanced my understanding of what kind of challenges people face in accessing healthcare services. That was a change moment for me. This led to my increased inclination to do something to change the situation, to change accessibility of healthcare services to the masses. While working with development sector, I learned about public health and that diseases can be prevented, thereby reducing burden on healthcare facilities and, more importantly, reducing burden of disease on poor people whose out-of-pocket expenses further pushes them into poverty, which also has been proven in research. After my social work training, I joined the third sector and worked with many non-government organizations in different parts, different geographical areas of India. While working with NGOs, I got opportunities to understand the vulnerabilities of a variety of populations, such as rural population, sex workers, transgenders, gay population, migrant population, slum dwellers. I observed some have little access to education, employment, and health facilities, while others, especially the privileged one in urban areas, have much better access to health services. My work with the rural population, I noticed that the young girls in rural areas took care of their siblings, which led to their exclusion from the primary education from the school. They get married at the tender age of 14 years and become mothers by 15 years of their life. When illiterate, low literate people experience complete parenthood by the age of 21 years of their life, which they also think is the purpose of life, how long can they expect to live? And this tradition of early marriage, followed by early motherhood, is celebrated, is a well-accepted norm in many communities. There is no provision of counseling, lack of promotion of contraceptive use, poor nutrition status. Many such factors lead to poor health of women. The position of healthcare workers in remote rural areas remain vacant. Who do we then expect to generate awareness among women in such circumstances? How do we expect the situation to change? Similarly, lot many newborns and infants remain unvaccinated and thus keep falling sick in not just rural areas, but even in urban slums. According to UNICEF, while vaccination rates did increase, like in India, just like globally. However, 2.18 million children were not vaccinated in India in 2017. There are factors affecting vaccination of children on both demand as well as supply side. Social factors such as migration, lack of awareness, inaccessible health facilities on demand side are major factors. On the supply side, unavailable trained health professionals, insufficient vaccines, storage issues are some of the factors affecting vaccination of children adversely. My Leader for Health Equity project aimed to utilize women's agency in South Delhi slum area in bringing about change for vaccination of children. To improve the vaccination rate of children, I formed groups of low-income migrant community women. I focused on increasing interaction of community women with the healthcare worker. Most of the community women are even scared to talk to the healthcare worker, let alone asking for better services. Currently, the group members discuss about vaccination with non-members and thus are forming an aware critical group to raise the issue of insufficient vaccination services in their area. The first female president of India in 2008, Mrs. Pratibha Devi Singh Patil, raised her concern to reconcile economic growth with social inclusion in society. She noted India's impressive economic growth was not yet allowing the underprivileged and disadvantaged sections of society to find a place to enjoy the sunshine of the country's growth and development. We now know that the social determinants such as place of residence, education, employment, and social hierarchy are important factors in determining access to health services. We also know gradation of caste that people belong to owing to their birth in a specific family is totally out of control of people accessing health services. Caste is a critical social determinant that nobody chooses, but is thrust upon people that leads to discrimination, that determines if one will have better education, that determines if one will have access to health services, health information, health products, employability, and so on. The vulnerabilities of lower caste people are amplified when they migrate to cities in search of work, usually as unskilled labor, and live in urban slums with bare minimum facilities. Taking a day off to seek healthcare services means loss of wages. Therefore, they pray that they do not fall sick. To compound the situation, in many places, the health staff deployed in slum areas or in rural areas are often absent from their work or are not able to reach the designated areas. The data many times are fudged, and therefore the statistics do not show a true picture of health services provided to the most vulnerable populations. In such a scenario, women suffer more as they have to care for family members and work to earn wages. They have little time to pay attention to vaccination of their children. What migrant community women can, however, do is unite. Unite and share joys, sorrows, information, experiences, challenges, and thus learn from each other. They can discuss with each other how to save their children, how to reach health facilities, where to get their children vaccinated, and how to protect them from diseases. And this sharing will give them power to ask for their entitlements, power to demand services, which is their basic right. The strength of the lower caste migrant population needs to be capitalized to generate demand for health services. The most important strength of the lower caste migrant population is links that they have with each other that also brings them to the cities. The privileged ones, just like you and me, must use their knowledge and skills to bring about the change needed to reach out to the poorest of the poor. I say to my privileged colleagues, medical fraternity, social workers, public health professionals, and community women, and many others, never ever underestimate yourself. Have faith in your talents and your potential. No action for improving health equity is small. We all have the potential to contribute in some ways. I call upon public health professionals to introspect themselves and assess how best can they contribute in bringing about health equity, in prevention of disease among most vulnerable populations, in saving a mother from dying during pregnancy or during childbirth, and how best can they save every newborn. As Mahatma Gandhi said, you must be the change you wish to see in the world. I ask, will you be the change you wish to see in the world? For you and I can make a difference. Thank you.